As parents, caregivers, and community members, we know today's kids are growing up in a complicated world. From kindness and empathy to online safety, bullying, emotions, and confidence, sometimes the hardest part is knowing simply how to start the conversation. That's where Bright Littles comes in. Created by a mom and developed alongside educational experts, Bright Littles offers award-winning conversation cards, journals, and digital toolkits designed to help families build stronger connections, one conversation at a time. Their mission is simple: raise brighter leaders through meaningful dialogue, empathy, and understanding. Whether it's around the dinner table, during bedtimes, or on the ride home from school, Bright Littles gives parents real tools to help kids navigate challenges with confidence and compassion. Because sometimes 5 minutes of honest conversation can change everything. Learn more at brightlittles.com and start building brighter conversations today. That's brightlittles.com. Welcome to Pulse Check, Wisconsin. All right, welcome back to Pulse Check, Wisconsin. Good morning, good evening, good afternoon. I'm Dr. Chris Ford, emergency physician and host of the show. Today, we are very fortunate to be joined by Milwaukee County Executive and gubernatorial candidate David Crowley to discuss the future of healthcare here in Wisconsin, some of the challenges that we're facing as healthcare workers, and what can be done to make our system safer and stronger. David, man, thanks so much for being with us.
Man, thank you for having me, Chris. Such a pleasure to be on with you.
Absolutely. With it, as we know, you are a Milwaukee native, born and raised, former assembly member, the youngest to serve as county executive. You have a unique perspective, not only of the city, but as the state. You've spoken in the past about growing up in Milwaukee and seeing some of the disparities firsthand. How did those experiences shape the way that you think about healthcare access in Wisconsin today?
Well, it really built that foundation. You know, one, when I think about not just physical health, but also mental health, seeing my mother struggle, you know, with depression and bipolar, but also drug addiction. And so it's about how do we really approach healthcare holistically? And for me, Chris, like, health isn't just mental and physical, right? Money in your pocket is health. Having a roof over your head is health. Public education, public transit, all those things, you know, contribute to our social determinants of health and give us an opportunity not just to focus on individuals, but how we're actually lifting up communities. And so I want us to become the healthiest state, and I want us to do that by actually improving our health outcomes, and not because other communities or other states are actually failing at and actually improving and moving the needle when it comes down to healthcare. But it really is the foundation of who I am. It's why I continue to talk about why we need Badger Care to become a public option, you know, because I believe it's one of the greatest pathways of creating that parity and making sure that we can strengthen the system, rural communities, urban communities, and suburban communities.
Yeah, and that's the thing that you brought up too. This affects people across the spectrum, right? So if you live in a rural area of Wisconsin, if you live here in Milwaukee, it affects you, right? Healthcare is one of the top issues that we see, especially in our voters, continuously being brought up across Wisconsin. I know as you're traveling the state, you're hearing it from people all over. What are you hearing and what do you believe are some of the biggest challenges that are facing people in our state right now?
Well, we know that there's an affordability crisis. Being able to afford insurance so you can go to your doctor of choice is a huge concern. When you go into rural areas, it's not just the insurance aspect, right? It's also the fact that we have seen hospitals, we have seen clinics literally closing down, right? Because they're not getting the traffic or the reimbursement that they should be getting as it relates to Medicare. And so we have to tackle these issues head on, and it's going to be very difficult for the state to do it on its own, especially after many of the decisions that have been made in Washington, D.C. with this big, ugly, beautiful bill that they try to call it as, and now we have a candidate running as a Republican who's been lockstep and actually voting and taking away health care and taking away reproductive rights from women all across our entire country. And so we have to stand up and we have to put a line in the sand as it relates to who we want to be as a state. But it's not just the governor who's going to make that happen. We need that trifecta, making sure that we're getting Democrats elected in the state Senate and the state assembly, because it's going to take legislative willpower in order to make all of these things happen.
Yeah, and we get, like you said, we get that opportunity to get that trifecta to actually get the ball rolling here, right? And as county executive, you've been very successful at overseeing some major public health and community initiatives here in Milwaukee County. I've seen it firsthand as a provider as well as a healthcare advocate. What are some of the lessons that you've learned from that experience here in Milwaukee that can be applied statewide?
Milwaukee County, we're unique, and, just to give people, a little bit of history, I was sworn in May 4th of 2020. And when you think about like trying to tackle public health, it was extremely difficult here within Milwaukee County because we're the largest county, the most diverse, but also the most challenged. And we're the only county without a countywide public health department. And so we've had to navigate. And what I've learned being a county executive representing 19 different municipalities, close to 1 million people, is that there isn't this one-size-fits-all solution, right? You have to right-size the solutions, but more importantly, the communities that you're working in, you have to pull up a seat for them to be at the table, right? If you're not at the table, you're on the menu. And so they have to lend their voices to help right-size the solutions that's going to help them move forward. And I've realized that, we have to put our money where our mouth is. We continue to talk about healthcare and the mental and the physical aspects, but we're not making the investments that is needed and making sure that we're bridging the gap for people to get access to the care that they need. And so mental health, we're extremely lucky here within Milwaukee County. We have a very imperfect system, but at least we have one, unlike many of the communities across the state of Wisconsin. And so we've built a mental health emergency center so we can get people stabilized, get them access to community-based care. But I know that many communities don't have access to that. And so we want to strengthen our emergency medical services across the entire state. We know a lot of people rely on, for example, volunteer firefighter services, and that's going to be hard to sustain moving forward. And so we have to strengthen this across the state, and we have to work with our local municipalities to incentivize them working well with one another to figure out how do we create the systems, the infrastructure that is needed to create a more sustainable future as it relates to healthcare in every aspect.
Yeah, we talk about, some of those deserts as well, right? We often hear, healthcare deserts both in the rural setting and the urban setting, but you spoke to something there that a lot of people don't touch on, and those are those mental health deserts that are going on, right? We see the rates of suicide, go up, the rates of, self-inflicted gun violence go up in those rural communities with that absence of those resources. So that's definitely something that is needed. And in looking, you touched a little bit on it as well about rural hospital closures, right? And staffing shortages that we see that continue to impact Wisconsin communities. What steps do you foresee that you would take to strengthen that access to care, both across, here in Milwaukee in the urban setting as well as in the rural areas?
Well, one, we have to support our young people, especially while they go to, through tech colleges or go to one of our great universities here in the state of Wisconsin that's going to pipeline them directly into these healthcare opportunities, right? And getting them ready, because it's not just about, the practical applications, but also the technology and how that is evolving as we make decisions. But it's also about providing all the other services that people rely on. I heard the story up north. There was a married couple, both doctors, who are going to accept an offer here in the state of Wisconsin to work at one of the hospitals. They had to rescind the job offer because when they were not only looking for a home, they couldn't find one, but the most important thing for them was actually childcare, right? Having 2 young kids under the age of 7, they want to make sure that while they're working, their children can be taken care of, but we don't even have that available in many communities across the state of Wisconsin. And so it's about how do you wrap around all those other services, those ancillary services that people rely on, are making sure that public schools are fully funded, right? No one wants to move into a community not believing that that school is going to educate their child, right? Public transportation is a huge component, especially here in large urban centers like Milwaukee County and other communities across the state, because people want to have that ease of access of being able to get to and from their workplace. And so there's so much that we need to do, but it's not just one thing. We have to tackle so many different issues simultaneously in making sure that we can retain and recruit more people to come to Wisconsin. But it's also going to take tackling the affordability crisis, right? We know that many people are spending a lot more money on their premiums, on out-of-pocket care, because of what has happened in Washington, D.C. And the cost of living is rising for everybody right now. And so it's extremely important for me that, we work with the legislature, that we work with our healthcare systems, we work with our insurance providers, and really put our heads together to figure out how we decrease as much cost as possible. But one of the first things that we can do as a state is pass legislation allowing Badger Care to become a public health option so people can get access to the care that they need.
Are you looking for art that inspires and gives back? Check out Artery Inc., a Milwaukee-based, woman-owned company blending anatomical art with purpose. From tees to stickers, their designs celebrate the human body and support real causes. Right now, shop the End Violence in Healthcare campaign, made in partnership with PulseCheck Wisconsin. Proceeds help raise awareness and push for safer workplaces for healthcare workers. Visit arteryinc.com and wear your support with pride. That's arteryinc.com. Art, wellness, and action. Yeah, and you bring up a good point there. We had a very slight win earlier in the year when we saw some of that expansion go to new moms, right? Like moms in the first 12 months that are postpartum, right? But there's still more to do, like you said, right? And so Wisconsin, we still have this ongoing conversation around Badger Care or Medicaid expansion here and healthcare affordability, like you spoke to. What is your vision to working with the legislature? We'll see how the midterms go, but what is your vision for making the healthcare more accessible and affordable for Wisconsin families who, frankly, are crumbling under the pressure of these costs?
Well, under a Democratic trifecta, we can absolutely make that happen, right? This is something that Democrats have been beating the drum on for at least a decade, and it should have happened a long time ago, but we're behind the eight ball. But now we also have fairer maps that are in place, and it is my hope and my goal that, one, we have the trifecta, but if not, we're going to be bringing in new people into the legislature who are going to be thinking about their constituents. And I don't care if you're on the left or the right, people care about healthcare and people want to make sure that they're insured. And it's not just those who don't have insurance. This also affects those who are in the private insurance market as well, because it affects their premiums when people have to utilize emergency rooms, emergency services as their primary care. And so even without that trifecta, having a fair maps, I do believe being one of the most, successful Democrats in the state of Wisconsin, working through a Republican-controlled legislature, right? We've been able to bring back more money, not just to southeastern Wisconsin, but to every community across this state. We've been able to negotiate and compromise, right? Making sure that more voices are at the table to make sure that we can actually pass pieces of legislation that's important to everyone. And so I think this is a great opportunity for us to continue to talk directly to the values of Wisconsinites when it comes down to healthcare. Because this is about how do we invest more upstream and address the root causes when it comes down to healthcare, because we can save a lot more money. Our goal should be to reduce the amount of people going to the doctor because we've invested more in preventative care.
And you made mention there one thing that I want to make sure we touch on, but as you said, when people don't have the opportunity to seek care in the traditional avenues, so going through their primary care doctor, preventative care, getting their insulin, right, being able to take their blood pressure medication, they end up in the emergency department, right? We know it well, right? And that's leading to many healthcare workers who, unfortunately, who are already in a shortage, right, here in the state of Wisconsin. They're leaving medicine due to burnout, right? They're leaving medicine due to staffing shortages, boarding crisis, moral injury that's going on. What role do you think state leadership should play in not only stabilizing the ability to have access to health care, but also stabilizing, our healthcare workers who are trying to combat this in our healthcare workforce?
I think it goes even beyond that, right? I'm reminded, my father used to say, you can't take care of anyone unless you can take care of yourself first. And there's a lot of burnout. And that started, let's face it, especially with healthcare workers who were the essential workers during the COVID-19 pandemic. And it's not like we've become healthier. We've actually become sicker, right? More people are going to the doctor. We've seen a rise in healthcare costs here in Milwaukee County, and we're seeing it within, private sector as well as governments across the state of Wisconsin. But one of the ways that we can help out our workforce specifically is by investing in mental health care, right? Making sure that we're working with hospital systems, working with clinics, working with healthcare workers about what exactly do they need. You can't walk into somebody's house and tell them how dirty it is and how you're going to come fix it up, right? We need to bring folks to the table, right? We need to be literally asking the question, what do you need and how we can actually provide that? But more importantly, how can they be a part of actually providing that solution? Because we need one another, right? The healthcare peers are going to have to lean on one another, having these conversations. And we got to get rid of this stigma when it comes down to burnout and when it comes down to mental health, and making it and normalizing having these conversations. And until we do that, we're going to see this cycle, right, of people leaving the workforce, continually seeing burnout, continually asking themselves if they're even worth it, because people are chewing them up and spitting them back out because they're just worried about making sure that they can reach the bottom line and reach their goals as a company or as an organization. But we have to combat this, right? And a lot of this is because of the division and the distractions that are coming out of Washington, D.C., that are coming out of candidates' mouths, because that's how they're going to win elections. That's not how we move forward as a community. That's not how we move forward as a state or a country. It's about building a bigger table and allowing people to voice their opinions, voice the issues that are on their chest, and figuring out how we row in the same direction together.
Absolutely. One of the things that we saw here in Milwaukee over the last couple months, as well as recently, we're seeing an increase or a spike in healthcare worker violence, not only nationally, but in the state as well. We had an event here in Milwaukee at Aurora, right? There was a shooting in the lobby. We had an event. One of my friends actually was assaulted recently in one of the hospitals that we work in too, right? And so we're seeing this become, an issue that we can no longer turn away from. Many of us in emergency medicine and hospital care have experienced threats or assault firsthand, right? Why do you think, just to kind of touch on it, why do you think this problem has escalated to the point where we're seeing it, almost routinely, monthly at this point?
Well, one, we have to understand that there's been a viewpoint related to whether or not people can trust healthcare. And a lot of that is because people have not been heard or listened to. But I think it speaks directly to the fact that folks are going to the hospital for their mental health care and not necessarily getting the proper medication or the proper treatment that they need, because many of our hospital systems aren't set up to deal with the level of mental health that we're seeing in communities. And this is where, we step up as a county, where we have to step up as a state, right? How do we work with our hospital systems in making sure that there's no wrong door when it comes down to the services that counties provide or that the state provide, right? And so if somebody is coming into a hospital system, yet they need mental health care, how do we create that handoff, that warm handoff to a Milwaukee County or to one of the community members, community-based services, to make sure that they're getting seen, they're getting the assistance that they need, or getting the medication, right? Because there's a lot of individuals who have mental health issues that go undiagnosed because they're not getting seen by getting the proper care that they absolutely need. But when it comes down to the violence, right, I think that we all have a play when it comes down to community violence. And it's not just, saying police officers come after the fact. They're not proactive, right? And so how do we invest in more community violence interventions, working with trusted messengers on the ground who have relationships with hospital staff, who have relationships with other community members, to have conversations about, people who are in our community, because we know who they are. We've been able to identify them, especially in Milwaukee County. If they're homeless, right, and they've been out there, we've developed these relationships to make sure that we can help them find housing, because it makes it that much easier to wrap around all the other services around them. And so we have to think outside the box, and we can't continue to invest in the status quo, because the status quo is not protecting people and it's not giving people the services that they absolutely need.
Yeah. And, following a lot of these events, I'll tell you, being in the trenches, right? Like, many healthcare workers feel unsupported. They're following these, violent attacks, things of that nature, right? What responsibility do you feel that hospitals, state government have in protecting healthcare workers? And is that something that we need to build a standard, right? Like, we need metal detectors. We need to, advocate for de-escalation. We need to do these things to take the onus away from the victim themselves. I feel like I hear that over and over again from my colleagues.
Well, you have to work with the systems, right? Because those are the organizations that employ our healthcare workers, and really bring them to the table. And it's not just about asking them what do they need, but it's also holding them accountable, right? Because there are probably things that you all are asking for that you're just not getting. And we at the state level, at the county level, at the community level, we have to hold large organizations accountable and making sure that they're not only doing the right thing, providing the care, but how are you making sure you're protecting those individuals who are providing the care? And so this is absolutely a conversation that we have to have. Our hospitals should be the safest place that folks can go. It should be a safe haven, no matter what crisis that you are in. And so in order to do that, we have to make sure that we're creating the levels of partnerships Again, it's not just with law enforcement, but it's with other community providers and making sure that we're lifting up the voices of healthcare workers to make sure that their voice is not just being heard related to the issues, but what are the solutions that you see? Whether you are walking through the parking lot, going to your car, or somebody is coming into that emergency room and dealing with their own mental health crisis in that moment, how can we become a part of the policy, a part of the procedure, a part of that no wrong door system to make sure that people are getting the care that they need?
Yeah, absolutely. Well, let's say, 4 years from now, we're looking at Governor Crowley, right? If elected governor, what does success for you look like in Wisconsin in 4 years from now? So either that be healthcare, any other initiatives that you're working with, what does that look like for you?
Success for me is building a much better, solid foundation for families all across the state of Wisconsin. It's making sure that we are raising the minimum wage to $20 an hour and getting people the ability to actually support their family. It's building more houses across the entire state. That's not just affordable, also attainable, right? So people can have a safe place to lay their head and think about all the issues that's going on in their life. It's about investing in our public schools, right? I have 3 daughters who attend Milwaukee Public Schools, and I want them to have the best access to a great education as possible, just like every young child in the state of Wisconsin. And so we have to make sure that they have the 2/3 funding. But the real goal is to make sure that we are the healthiest state by 2035, right? I want everybody to look through a different lens when it comes down to health, because it's not just mental and physical. And our health should be moving our entire state forward, and not just the individuals who have the ability to afford insurance, who have the ability to afford their healthcare premiums. We have to be able to lift up our most vulnerable communities everywhere across the state, because when everybody does better, everybody does better. And so I truly believe that the success of this campaign is how we're going to bring more people to the table and make sure that all communities have a voice and they feel a part of the agenda and the vision that we're pushing forward. Because let's face it, the frustrations isn't just with, who's occupying the White House or with Republicans. People are frustrated with our party too, the Democratic Party as well, because we have been fighting back, but we haven't created and really communicated what the vision, the agenda is moving forward. And that's where we have to become better, because we have to organize. We have to bring those lost voices back, because no one cares what you know until they know how much you care. And that is what we're missing in politics today.
Yeah, absolutely. Well, like you said, you touched on a lot of things at the state level that are giving people headaches, giving real working class families issues, things at the national level that definitely go against the working class. What gives you hope about the future here in Wisconsin, the future of this country, despite the challenges that we are facing day in and day out?
Honestly, it's the people that give me hope. When I travel across the state, it's not just me giving and talking about the agenda and the vision that I have for Wisconsin, but I've been listening and hearing the stories that people are telling me and how they're being affected. But more importantly, they want to get engaged. They are asking, how can I help? How can I assist? What do you need from me moving forward to make sure that my family is good and everybody else's family in the state of Wisconsin is good? And so that's what really gives me hope, is that people are waking up to what is happening in our country. People are upset and they're ready to be engaged, to be activated, to be not just a part of the election cycle, but making sure that policies are actually being improved and it's going to help people on the ground, especially our most vulnerable residents. And so without the people, without the infrastructure that we have created between the many different communities that we have, it's hard for us to move forward as a state. And so that's what makes me hope, is that many people are now frustrated to the point that they are 100% dissatisfied, and now they want to be engaged. But it's our job as elected leaders, as community leaders, or just neighbors, right, to make sure that we're walking alongside one another, because every role isn't for everybody, but there's always a role for somebody when it comes down to the prosperity of our communities.
Or County Executive Crowley, I appreciate you making the time here. How do people get involved with your campaign? How do they, reach out? What, if someone is interested, what are the next steps here?
Well, first and foremost, you can visit my website, crowleyforwi.com. And you can follow all of my social media, no matter what platform it is crowleyforwi.com. And we want people to sign up. We want you to volunteer, get our newsletter, but also contribute. And so you can email us at david@crowleyforwi.com. Let us know, tell us your story. right? We want to be able to share your story and let people know what people are going through. But more importantly, those stories, they help us to create the narrative of where we need to go moving forward. And so looking forward to meeting as many people on the campaign trail as possible, but please reach out to us any way you can.
Absolutely. Absolutely. Well, David, man, thanks again, bro. I'm sure I'll be seeing you out. You're always advocating here in Milwaukee County. I'll see you around the way. And don't be a stranger, man. Let me know if you need anything.
Absolutely. And appreciate the work that you're doing with your podcast. It's good to see you.
All right, bro. Good to see you, man. As always, take care of yourselves, take care of each other. And if you need me, come and see me.